Hi, welcome to a brief presentation on youth prevention and workplace efforts. I'm Amy Ronshausen, the Executive Director of Drug Free America Foundation. Drug Free is a national and global drug prevention and policy organization committed to developing strategies and educational programs that prevent drug use and promote sustained recovery. Our vision is a world where all people live free from the burden of drug abuse. Drug Free America is a non-governmental organization in special consultative status with the Economic and Social Union of the United Nations. And we just celebrated our 25th year anniversary. Drug Free produces educational campaigns on trending drug demand reduction topics that include short animated videos and resources such as one-pagers and infographics. These campaigns are pushed out through cross-platform digital marketing and are free to use and can be co-branded. We currently have a series of 4 high-quality videos that are marketed in the US and in targeted countries worldwide. Collectively, the videos have garnered more than 13 million impressions and have driven over 100,000 viewers to our website. One of the topics in this series is protective factors. Building and enhancing protective factors with youth is always an important focus for prevention, but even more so during the pandemic and in times of political and economic uncertainties. Understanding protective factors and how to build strong, healthy children and families can prevent kids from experiencing adverse childhood incidences and initiating into substance use. The educational video and resources raise awareness on prevention and provides tips on fostering drug-free youth and families. Let's take a look at the first video.
Around the globe, 35 million people suffer from substance use disorders. Not surprisingly, most of them started using as adolescents. And while there are certain factors that increase the risk of developing a substance use disorder, there are many other factors, starting in childhood, that can actually reduce the risk. These protective factors are characteristics within children or their environment that enable them to successfully manage and adapt to life's challenges. Being a fully engaged parent begins with being a role model for your children. Communicating well with kids and their teachers, plus staying closely involved in school activities and homework really pays off. Children tend to earn better grades, develop better social skills, and partake in healthier activities while avoiding more risky behaviors. With the onset of adolescence, young people become more independent and more likely to be influenced by peers and others outside their family, which adds up to a greater chance of being exposed to drugs and alcohol. So, it's critical that parents become educated on the subject and have family discussions on the dangers of drug and alcohol use. Be sure to carefully monitor your children's friends and activities as well. Plus, setting clear rules along with firm discipline goes a long way in helping them avoid risky behaviors. Keeping teens focused on healthy activities such as sports, youth clubs, or volunteering will also keep them on a safe path. Remember, children not only listen to what adults say, they watch what we do. As a parent, one of the best things you can do to prevent young people from using substances is to set a good example yourself by avoiding the use of alcohol, drugs, or tobacco within your home. We can all play a role in building protective factors for young people by adopting healthy habits, setting clear boundaries, providing encouragement, and by simply listening. For more information about building protective factors, visit Drug Free America Foundation at dfaf.org.
Supplemented video, Drug Free created a resource for adults as well as one for youth. This is the adult resource and it can be found on our website, downloaded and co-branded at no cost. Our youth-focused resource was created in partnership with local teens who brought to our attention that it's not only adults who can build and enhance protective factors, but youth can also play an important role in doing so with their peers. In addition to creating educational campaigns, Drug Free is happy to partner with and promote initiatives created by our drug demand reduction family, such as the One Choice program. Developed by the Institute for Behavior and Health, they aim to reframe the goal of substance use prevention as one choice. That's no use of alcohol, nicotine, marijuana, or any other drugs by youth under the age of 21 for reasons of health. 90% of adults with substance use disorders began using one or more drug like alcohol, nicotine, or marijuana before the age of 18. A key reason for this is the unique vulnerability of the still developing teen brain to substance use. The earlier substance use is initiated, the more likely the individual is to develop a substance use disorder. Promoting and encouraging the one choice message of preventing and delaying all adolescent substance use can have a direct impact over time on the number of adults who develop a substance use disorder. The One Choice Initiative has an online toolkit, social media resources, and encourages communities to collaborate and strategize together to work with youth. Today's youth are bombarded with pro-drug messaging on social media, and sometimes even in their own communities. In the US and in many other countries, there is a growing trend to legalize marijuana. Legalization equals commercialization, and commercialization means marketing. High-potency marijuana products like the ones you see here are made to resemble common branded candies and food products. And it doesn't stop there. This growing market has advanced to soft drinks and supplements. The more our youth see these products, the more normalized they become. A study done in California showed the impact of such marketing. This study looked at a little over 6,500 radically and ethnically diverse students from 16 middle schools in Southern California who went on to attend more than 200 different high schools in the region. In 2010, around 25% of these youth reported seeing a medical marijuana ad in the past 3 months. In 2017, that number went up to 70%. Teens who report seeing more marijuana advertisements were more likely to report having used marijuana in the previous 30 days, more likely to say they expected to use within the next 6 months. They expressed more positive beliefs about the drug, such as agreeing that using marijuana can help them relax, let them have more fun, or temporarily escape their problems. With this environment in mind, it is now more important than ever that youth are provided with data and science-informed prevention messaging. Drug Free is happy to partner with IBH to promote the One Choice message and is active in creating and directing social media content and spreading the message to our global partners. Now I want to transition from youth to the workplace. One of our long-standing divisions is the National Drug-Free Workplace Alliance, or NDWA, whose mission is to be a national leader in the drug-free workplace industry by directly assisting employers and stakeholders, providing drug-free workplace program resources and assistance, and supporting a national coalition of drug-free workplace service providers. This is accomplished through directly assisting employers in assessing their workplace and establishing comprehensive drug-free workplace programs that include a written policy, training and education of supervisors, employees, and parents, drug testing program enrollments, employee assistant programs and referrals, and support to employees seeking treatment or for those who are in recovery. Training is a key component to a successful drug-free workplace program, and Drug Free America has developed online courses for both supervisors and employees. These trainings are applicable to both small and large workplaces, and they meet the requirements for those regulated by the U.S. Department of Transportation. As frontline leaders, supervisors are trained how to recognize the signs and symptoms of substance abuse, how to document those indicators and related performance issues, how to intervene when necessary. With the supervisor support and understanding of the program, both employees and the employer will benefit more fully from the overall drug-free workplace program. Educating employees allows them to fully understand their workplace program and how substance misuse has a negative impact, especially where safety is concerned. This division of Drug Free America offers membership that empowers workplace safety, wellness, and recovery. It lets employers unite with their employees and stakeholders to share a strong, unified voice in pushing back against the harms of drugs and alcohol in the workplace. It also allows Drug Free to advocate on the members' behalf and to preserve and strengthen employer rights to maintain safe and healthy work environments that promote prosperity for all. Services in this division include written drug-free workplace policies and supporting forms, assistance in policy implementation and accessing insurance discounts, setting up drug testing at very affordable rates, online training courses that we went over for supervisors, employees, and working parents, employee assistant program referrals, news and updates related to workplace issues, and consultation with our staff. This division has produced a variety of workplace webinars and resources over the past years that focus on substance misuse topics, including those affecting the workplace. Some of the webinar programs include impacts of marijuana and opioids on today's workplace, identifying impairment, stigma in the workplace, and recovery-ready workplaces. In partnership with the Colombo Plan and with support of the Bureau of International Narcotics and Law Enforcement Affairs, Drug Free America was able to expand our reach in this area by creating a training entitled Establishing a Drug-Free Workplace that is part of the Universal Treatment Curriculum for Substance Use Disorders. This training has been provided at ISIP conferences both in Kenya and Austria. In closing, I want to invite you to check out our newly established podcast called Pathways to Prevention. The podcast is a collection of interviews conducted with experts in substance use, prevention, treatment, and recovery. Highlights to date include episodes on school-based prevention programs in Afghanistan, building recovery capital in Macau and the Baltic region, the realities of marijuana legalization in the Americas, gender-based strategies for women and girls, and much more. You can search for Pathways to Prevention wherever you listen to podcasts, and we hope that you'll contact us if you'd like to be our next guest. We would love to highlight the great work that you're doing in this field. You can follow us on social media for more information on new research and current drug trends. Thank you so much for your time today, and I look forward to answering any questions you might have during the live question and answer session. Thank you.